G'day everyone, welcome back to the channel. So in today's video, I want to take you guys through a few different exercises to help improve your shoulder internal rotation. And we'll get to why that's really important in a second, but as a spoiler, it's crucial in order to allow your shoulder to function normally. So if you're someone who has any sort of shoulder pain, any shoulder dysfunction, whether you just want to be a better athlete, whether you're a throwing athlete or you use your shoulders a lot day to day, these exercises might hopefully address one of the missing hidden pieces of your dysfunction, and obviously let me know how that goes. So before we get into the video, obviously please let me know in the comments, what's brought you here, what are you dealing with, what are you hoping to learn from these videos? And if you enjoyed the video, please consider leaving a like rating down below. And then if you're someone who enjoys this content, if you really want to learn more sort of helpful pieces of information to help make your body function better, whether that be pain related or performance related or just day-to-day life, please consider joining in and subscribing. These videos are hopefully symptomatic of the type of information that we're bringing across. It's things that are born out of day-to-day conversations in the clinic as a physical therapist. So it's really important that if you're someone who is looking for an answer, hopefully you'll find a piece of that here. So if you consider subscribing, that would be great. So getting into the video itself. So when we talk about shoulder internal rotation, we're really talking about your ability for a lot of people to reach behind your back. So shoulder internal rotation is essentially if you were to bend your elbows to 90 degrees, if you were to rotate them inwards internally, obviously your trunk gets in the way, but it also categorizes your ability to then get behind your back and lift your hand off the back of your back or your butt, however high you get. Now, the reason why this is really important is that if you're missing some of that shoulder internal rotation, then your body has to compensate for that in order to complete the task. So if the goal for me is to get my hand to 90 degrees, if I don't have the capacity to keep my shoulder back and the internal rotation mobility or the range of motion to keep my shoulder in a good position to get there, so as you can see here, I'm probably a few degrees short, but if I'm trying to get to that back position, you'll see what happens to my shoulder. My shoulder starts to dump forward a little bit. So if you see people who take photos and they're in this position, it's a bad shoulder shape. What this is it's a compromised shape that changes the way that you load up all the tissue in your shoulder, but more specifically the tissue at the front. So if you have a biceps tendonitis, maybe there's some ligamentous issues, some rotator cuff stuff, a labral issue, whatever it might be, some bursitis, then part of that puzzle might be that you don't have enough internal rotation to load your structures up normally for the entire range of motion that you need day to day. So you might find that instead of being in this position and functioning throughout the day, you might be dumping into this position a lot day to day and just compromising that tissue. So there's a lot of features that can relate to this, but internal rotation is a nice, easy one to attack. So the first of maybe 3 variations that we'll get to involves a ball. So if you have a lacrosse ball, which is this, a tennis ball, baseball, anything that you feel has a density that is comfortable for you, we want to get you to lie down on the ground and place the ball in the back of that shoulder area. We're going to lie down on that tissue. And what I'll get you to do is, you can do this so this exercise you can do 2 different ways, is you can have your elbow out to 90 degrees, and we just get you to gently rotate or internally rotate that arm as you go. If you need a little bit more tension, you can roll onto the ball a little bit more and then rotate down. If you get to a point where you feel like your shoulder's starting to come up, you can hold it down and allow that internal rotation to happen with the ball. So what we're doing here is we're compressing that tight and stiff tissue at the back. And then what we're doing is we're trying to shear that tissue free by doing the movement that we're valuing without compromising into a bad shape. So we're going to try and stay in a good position, really force that in a nice way, respectfully force that sort of internal rotation to shear free some of that tissue. And then you can move the ball around looking for the spots that feel the most interesting to you and then repeating that process. So the second variation of that stretch involves you being able to bridge up. So what we want to get you to do is you want to bridge up and then have your arms out straight and then slowly sort of rotate them back underneath as far as you feel comfortable. Some people may only get towards to their back pocket. Some people like myself, I don't have a shoulder problem, thankfully, I can get a little bit higher here. And then what we want to get you to do is, again, keeping your shoulder down. We're not asking that shoulder to dump up into a bad position. With your shoulder blades back, internally rotate that shoulder behind you, bridge up, and then just gently lower your bottom down as far as you feel comfortable. And what we're looking for with all of these stretches is some lateral or posterior tightness at the back. Nothing jamming or catching at the front. And what this is doing is we're using your ability to lower your body weight down onto your hands and forearms to take you into relative internal rotation of the shoulder. And then we can get you to hang out here for a little bit. While we're here, we can get you to do some tense relaxing. So try and squeeze those tissues, tense up your deltoids, tense up your shoulders, front and back. Hold that for a couple of seconds. And then when you relax, you might find you can actually take it down a little bit lower than you could before. We want to keep repeating that process until you reach a point where you can't go any further. And then we want to disengage and see how you feel. And the good thing about these stretches is you deserve to see a change straight away. So if you remember from before, from this position, I now feel like I can get my hand down a little bit lower than I could before my shoulder wants to start to dump forwards. So again, I may not have necessarily changed the capsular restriction, that deep restricted capsule, but some of the soft tissue around that shoulder feels a bit lighter for me now, so I can move that a little bit further without feeling like it's compromised. Now, the second exercise here tends to address, or may address, some more of that capsular stuff, and it basically involves a power band. So if you don't have one of these at home, you can use a TheraBand, or some TheraTubing. It doesn't provide as much force. You might need to stretch it out a little bit further, but essentially you want something that's got some elasticity to it to help sort of distract that shoulder a little bit and keep you out of that painful range. So normally I do this standing, but for the purposes of the video, I'll do it kneeling. So what we're going to get you to do basically is sort of reach underneath the band and clasp your fingers around that. So you've got a really nice, stable connection there, one that you're not having to really grip onto, but the band sort of hooks into your hand, allows you to relax. I'm going to put you in some internal rotation. So again, for some people, getting towards your back pocket is as far as you can go. That's completely fine. The priority for this stretch is staying out of that dumped forward position. So before you wind yourself up, you want to get yourself into a good shape first, a good posture, bend your elbow a little bit if you can, and then walk out. Again, not ideal on the knees, but easy for the video. And we want to put yourself into more shoulder extension. And if your elbow's bent a little bit, it's going to basically rotate you around into internal rotation further. So again, going out as far as you feel comfortable, maintaining a really nice shoulder position. We can do some contract relax again here, where we sort of tense everything up for a few seconds and then relax. You might find you can go a little bit further into the stretch. Give it a squeeze for about 5 seconds, then relax. And what you can also do here, if you can tolerate this, is you can also rotate your trunk towards the side where the band is pulling. So for me, I can rotate around this way to essentially ask my shoulder to internally rotate further whilst the band's holding it in place. Again, we're not looking for any pain or tenderness at the front. If you are, you're in a bad position, most likely. And if you can't express this shape as well as I can, you're stuck back here, again, that's completely fine. But again, what you'll hopefully find after doing this is straight away, that shoulder should again be moving further than it did before. So hopefully, if you rewind the video, you'll see that this shoulder's going further before I feel like I need to dump forwards. So that's exercise number 2. Now the third exercise is essentially for a lot of those people that get into both of those shapes, but still feel like that tissue at the front gets a little hot or a little bit tender from the position, which means that either your capsule or your tissue is so tight, you can't keep it back in a good position naturally. So that tissue is consistently under tension when it shouldn't be. Again, that will hopefully explain some of your symptoms if you do have them. But for those people who find that it's a little bit harder to keep that shoulder back naturally, what we can do is we can lift the band up a little bit higher, and we can actually put the band around the shoulder to encourage that to happen. So the tension from the band is hopefully going to stop you from naturally dumping forwards as we try and express this internal rotation. So what I find is if you're directly in front of the band or pushing out straight from the band, it may not hit the right spot. So I like to be a little bit off to the side, not so much that the band sort of wants to slide down the arm, but you'll find there's like a comfortable mid-range position where the band tension is still on the joint line, the joint crease. So again, it's not down on the arm, it's not up around the neck, it's sort of where the joint line tends to be. And then with some leaning forward, by leaning forward, we can have a little bit more tension through there. And then what we see is that we can then start to rotate that hand behind more comfortably. And with your other hand, you can reach behind, and hopefully you can see this, and you can start to internally rotate that position. You can extend the shoulder further, you can pull it towards you a little bit more. Essentially, you can use that force to create that shoulder position. And what that does, again, is it allows you to keep that shoulder back while you internally rotate. Now, again, it does require you to be able to reach behind on the other side. So if you're stuck down here, it might be hard to do that. But even just being in that position and having the band pulling back is a really good way to buy some of that tissue in ways that we find is a little bit tricky without it. So with that being said, hopefully those exercises were useful. Let me know in the comments below, and we'll see you in the next one.